wanted to talk about with today's roundtable is kind of the relationship between the parents' own perceptions on mental health treatment, as well as how that looks in terms of the child treatment outcomes. We're planning on touching on a couple various parts of this, including looking at mental illness and the belief that it's a reflection of bad parenting, cultural factors that go into how parents perceive mental health treatment and what that exactly means in terms of barriers to the child having adequate mental health care, as well as what it means to actually have that mental illness label, and how this all just kind of ties into the stigma that is perceived by the parent and ends up being a barrier to the child's better mental health outcome. I think maybe we can take a minute for all the panelists to introduce themselves. But my name is Daniel Yu. I work at the Center for Community Research. My work mainly involves the research of MECFS. We're looking at a pediatric sample where we do mental health interviews as well as a full physical. And this all the roundtable has started off with kind of our experiences within doing these interviews. So if one of the other panelists want to introduce themselves and take it away.
Hi, my name is Ella. I am also a research assistant at DePaul University Center of Community Research, and I'm really excited to be here.
I guess I can go next. So my name is Maddie. I'm also a research assistant at the Center for Community Research. Currently, my interests kind of include the social, emotional, and psychological impact that living with a chronic illness can have on a patient. And my interest in this topic specifically kind of began when working for a pediatric psychologist in practice and seeing the good that can come out of a diagnosis.
Hi, I'm Krista. I'm a RA at the Center for Community Research. My primary research interest at the center, I look at a project that investigates the parent-child relationship and how parents and children report on their symptoms and health-related quality of life outcomes, just to see what the differences are.
Hi, my name is Chelsea Torres. I also work at the Center for Community Research, and I'm a second year in the Clinical Community PhD program at DePaul University. And I am interested in pediatric chronic fatigue syndrome and especially sociodemographic disparities within the illness. And specifically for this roundtable, I also work at DePaul's Community Mental Health Center for Children. And so I've been working a lot doing family therapy, which is why I'm interested in this as well.
And I'm Lenny Jason. I'm also at the Center for Community Research at DePaul University. And this whole team has been working on a couple studies, but one in particular is a large-scale epidemiology study of pediatric ME, myalgic encephalomyelitis / CFS chronic fatigue syndrome. And there really hadn't been a prevalent study of how many youth have this illness called ME/CFS. And we actually surveyed over 10,000 people in Chicago. We brought in people to have medical and psychiatric examinations to make sure they had this illness and not other things. And then we published our research suggesting that something like 1 out of 134 people actually has this illness as a youth. And what's most important is that you've all heard of the yuppie flu idea of ME/CFS. Well, actually, we found that in people of color, rates of pediatric ME/CFS were higher. And we also found that over 95% of those who we identified had never been diagnosed. So there's a tremendous number of people out there who are not well, who don't know what's going on, but they have this illness that's not very well understood or appreciated by our healthcare system. I'll turn things back over to Sam.
Great, yeah. Let's see, just pull up my notes. So yeah, so start off, we're basically going to cover various topics on why parents might be reluctant to report the presence or the actual severity of symptoms at times. And this is especially relevant in our studies because we tend to interview both the parent and the child separately during the mental health interview. And during that time, we've noticed trends where parents may have sometimes very drastic perceptions on what their child's health is, whether that's deliberate or they're just unaware. It's not always 100% clear, but I mean, it's definitely a big problem if the parent doesn't really explain the full depth of the child's symptoms, especially within the context of chronic illness. So I think, let's see here. So yeah, I think the first topic we should touch on is kind of when a lot of parents are concerned that if their child is diagnosed with a mental illness or starts seeking mental health treatment, it's a reflection on their own parenting. Kind of the idea that there's like the stigma that we have where if a child has depression or some other mental illness, maybe because they weren't cared enough as a child, or that sort of malignant idea is out there. There's also kind of the idea of mental illness stigma being associated with the family name, especially within certain cultures. You do typically put a great amount of effort into avoiding having that mental illness stigma associated with their family. Ella, if you want to start off that portion of the roundtable.
Sure. Hi, guys. So talking in terms of parents and their perceived stigma, it may be perceived, it also may be overt. So there is research that illustrates that when parents have disabled children or chronically ill children, that their place in the social order is altered, their claims of normalcy is often undermined, and valued relationships and identities are also disrupted. And this also goes towards mental health and invisible illnesses. And because of these effects of having a disabled or an ill child, these conditions are kept secret towards other professionals, other teachers, and other children as well. We will be going into how sometimes their diagnoses are also hidden from the child itself and how that may impact a child's development in the upcoming topics of this roundtable. We also find that this perceived stigma and these ideas of stigma towards mentally ill and disabled children are more rampant in middle-class families and upper-class families. And this is more because they have the resources, they have the education, and they have the time to dedicate to their children and their children's activities. They also tend to have a little more anxiety, middle-class families, since they have the more resources, they have more anxiety about maximizing their children's opportunities and success. And this leads them to kind of orchestrate their children's activities and lives and daily daily schedule. We also find that in these middle-class households, mothers are more likely to encounter the stigma and blame. They are also more likely to be sensitive to the culpability of their children's behavior. And this often is because even when fathers did encounter stigma, they don't really interpret it as a negative, as like negative intention or blame. And I do feel like this may lead to the more gendered ideas of parental raising and how mothers are often seen as the sole the ones most responsible for their children. And so I would like to pose to the group whenever, if anyone has any ideas, of how can we as clinical and community psychologists perhaps promote more parents to be forward with their children's conditions and to feel feel less less disconnected with their community if they have a child that may be chronically ill, mentally, or disabled.
So Ella, let me just kind of pose the one question is that parents might have difficulties in learning about what's happening with their children and might not understand it, but actually the educational system is pretty poor at trying to identify youth that have difficulties, as well as, you know, lots of people in the community sometimes fail to understand the special needs of youth. I can't tell you how many times I find that youth are stigmatized because they have severe fatigue and cognitive problems, and the educational system tends to kind of say, well, they just have to get on with it. You know, what's the problem? And they tend to sometimes be unsupportive. So I'm just kind of suggesting that, you know, from, you know, my perspective, it's sometimes the parents might get caught into a system of blaming children. And sometimes parents become maybe the most important, you know, spokespersons of really trying to protect and help their children with some of the abuses that occur in the educational system. Just kind of throwing that out. That's a quick reaction, Ella.
Oh no, yeah, you bring up a great point. Well, another really big topic I found when doing a lit search is that there is a lot of prominent sources of stigma, and that could also even come from the educational system, as you were saying, and the skills that are valued in our educational system more so than the other skills that are just as useful, but because of our culture, we value a certain set of intelligences, a certain set of skills. And for those who may not be able to understand that well due to a mental illness, that could also really hinder their self-esteem or even being able to express what they are going through in school or among colleagues or their peers, their other children, and express to their parents what they're going through. And then you also brought up a really great point, Dr. Jason, about parents not being educated. So that is a huge issue as well. And so then I have another question for anyone who wants to jump in. How can we educate parents into these illnesses to try to reduce this stigma that they might hold for other parents or they might hold for themselves?
And so just want to, because we need to transition to the next session. And so if you guys have if anyone has any additional questions for the presenters, if you send them in the chat box, we'll make sure that the presenters get those questions. Mm-hmm. Mm-hmm. Right. Okay. Mm-hmm. All right. We want to thank our presenters for the presentation. And if anyone has anything in the chat they want to send to get to them, please let us know. So now we will transition to the next presentation. Are the next panelists for the 9:30 session available?
Sorry, is the roundtable ending already? I thought it was until 9:20.
Oh my God, I'm sorry. I'm on Eastern Standard. So
Okay.
and I'm looking at my clock.
Yeah.
Like, oh, so My apologies. That's totally my bad. So my apologies. Keep going. Sorry.
I was gonna say, we have a lot more to cover.
Okay, I'm like, oh my gosh, it's 9:48 on mine, and CST is behind. So totally my bad. So my bad. Keep talking. But I did.
The question
Okay.
to you, there's a question.
Yeah, go right ahead.
Okay. From Ernesto, the question is, in discussing stigma in general, one challenge might be defining stigma. There can be sometime when some parents and individual may be understanding that's what that is. They may be internalizing a stigma, considering also the, so maybe it's not a question, maybe it's just adding a comment because I'm monitoring the question and that came in, so I thought it was a question. I'm sorry, go ahead.
That's okay. And thank you, Ernesto, for that comment. That is a really good point to think about. And they may not even know that they're internalizing the stigma. And that's also a really good thing to keep in mind. I also think Gwen, she added a comment as well saying that rallying with and crying and being frustrated with other similar families have been especially helpful for parents who have children who are ill, whether it's physically or mentally. And that is actually a lot in research, is that peer intervention is the most successful in reducing these stigma and these negative attitudes and negative internalizing that they might be bad parents because of their children. And finding support groups and peer groups have actually shown to be really, really helpful in helping parents and families and children cope with the illness that they have to carry.
Yeah, and then I wanted to add on to what Ernesto said about how parents and individuals may not understand exactly what internalizing stigma means, and certainly a huge issue, a huge component of this issue, especially since stigma it kind of permeates very abstractly, passively over time, especially if you've lived in a particular community. I think when we talk about kind of cultural factors later, especially when you're exposed predominantly to a culture maybe you live within. Later on, I'm going to talk about kind of like East Asian and Chinese American communities and their perspectives on mental health. But especially if you live within a particular community where the culture is a bit more homogenized, you typically, that's the only perspective on maybe mental health treatment that you're really exposed to. So yeah, we're definitely going to touch on that a little bit more and kind of how parents may struggle to identify this being an issue in the first place. So great comment.
I was also going to quickly say just, and I apologize if this has been mentioned, but I think the cause behind an illness also plays a role in the stigma and how it's perceived, right? So something that I think of, or at least an illness that comes to mind, is HIV. And unfortunately, the stigma that comes behind that just because of the cause, and how, one thing I've heard is, sexual promiscuity is something that's tied with that illness label. And so that's something I came to mind too, is the cause.
Great. Okay. I think we can move on a little bit from kind of the family name and mental illness stigma. Krista, did you want to talk about the next section a little bit?
Yeah. So the topic that I had to discuss was concerning parents' experience with their own mental illness when they have kids and they're trying to parent, but they're struggling with their own internal struggles. So the article that I was reading, it was actually a Norwegian study. I think it was in 2016, but what they were talking about is children who have parents with mental illnesses, they're kind of struggling. They have their own struggles, so they're also trying to be like other kids and trying to blend in and try to be like others. and they're struggling towards inequality with their own peers at school. So they also talked about the issue of having this be the child's responsibility, trying to fit in and trying to stay normal and not have a stigma towards their family life and their life at school. And so they kind of pushed the responsibility from the child experiencing this with their parents to a lack of knowledge, which Dr. Jason and Ella just kind of touched on. Lack of knowledge at societal and institutional levels. So why are kids having to experience this and get this responsibility pushed on them when people struggle with mental illnesses all the time? And so why does this stigma exist when it could be openly discussed and talked about at these institutions, like schools especially? So yeah, I just wanted to kind of open that discussion up on, while we're talking about parents, the child's experience is also very important in what's going on in the, like in their school systems, that they can't feel open to discuss their parents' mental illness.
Yeah, Krista, one thing that I thought about as I was thinking about growing up, I know in a lot of public schools, they implement within health class or just its own segment, you know, information on personal hygiene and growing up and that kind of thing. And I wonder what if stigma would improve if we also included a whole section on mental health and the outcomes and associations with that, and just how prevalent it is. A lot of mental health illnesses are, and just really encouraging that conversation at an early age, I think, is really important. Also, maybe facilitating or implementing a conversation during annual pediatrician visits, making that kind of a point that's made when talking to kids and their families. Just a thought.
Yeah, I see actually Raphael also had a comment saying, I wonder if it's a perceived cause that may be reinforced by biases as seen in describing of opioid AA populations due to perception of being able to handle more pain. And that I think takes stigma even beyond just kind of the parental level, and also how medical professionals and mental health professionals themselves need to be extra aware and sensitive to exactly the circumstances they're treating. Especially, I'm not going to keep going back to the cultural factors, that's what I'm going to be talking about later, but you know, being aware of the cultural backgrounds and the nuances and how mental health is perceived from family to family. It's also something you have to keep in mind and cater towards your treatment plan towards them. So, you know, especially within, for example, medical communities, you know, physicians tend to assume that you know, African American or Black youth are able to handle more pain, and they similarly to what you're saying is tend to under-prescribe them pain medication. So definitely, along with, I mean, the parent is also another form of a caretaker. They're probably, you know, going along with what Krista said about how if the parent doesn't really perceive this as if this is on the child themselves to seek the care or whatever needs that they need to have met, then clearly that's something that we have to be aware of. Yeah, I'm not sure if anyone else has anything else to add to that.
Yeah, actually, I think that you touched on a very important aspect. It's also, as we know, with Black individuals in the healthcare system, a lot of times they're, what they are describing to healthcare professionals, there has been many issues with them listening and validating those who are people of color and their symptoms and what they are experiencing, and is often delegitimized and dismissed, which can also leave, you know, parents and children wondering and in a limbo of what might be going on with them if they don't have a very clear-cut professional that can help them or talk to them about what their symptoms may be. And so that is a big issue that needs to be addressed among healthcare providers, and listening to not only mentally ill patients, but their patients who are people of color. That's definitely a huge problem in terms of healthcare.
Yeah, I'm also seeing Ernesto mentioned that that while schools can do great work with mental health awareness and advocacy, there are probably schools that don't discuss that or educate mental health and well-being in general. I know anecdotally, I was very privileged to have a school that did discuss mental health and general mental health awareness. But definitely, especially schools that maybe are underfunded or struggle to obtain funding from outside resources to expand mental health awareness programs, definitely something that needs to be addressed. And maybe even kind of going back to what our main topic is at hand, not only at the level of just talking to the child, but also to families in general and the parents as well. I don't know if anyone else has anything to add to that.
I was going to say, I didn't grow up in a big city or suburbs, so I grew up in a pretty, not a small town, but it's definitely, there was definitely a difference. Nobody really talked about mental illness or anything like that. I mean, we took our general psychology class, but even that was an elective, so you didn't have to take it. And a lot of the times people who did have a mental illness or were even going through extreme anxiety were labeled as crazy or nuts, or just those really harsh words that people attribute to kids or youth with having mental illnesses. And there could definitely be more resources, I think, allocated to more rural schools and educational systems to help with that, because then kids grow up and they think it's okay to just make fun of other people with mental illnesses.
Yeah, well, great point. That might be a bit of a connection issue. Pull up chat again.
So as Sam tries to reconnect, Gwen did add a question saying, are there things, programs, etc., that informal education nonprofits, thinking especially of museums, can do to help destigmatize mental health and long-term illnesses for families and for the community at large? I actually am not aware of any program that is informal and by a non-for-profit. But is there any program that you have in mind that may fit this description, or is there any programs that anyone knows of that could help destigmatize mental health and long-term illnesses?
I know the national NAMI, the mental illness, there's a National Association for Mental Illness. They have a really good program. I can't remember exactly what it's called. I think it's called something like Giving Voices or something, where they have individuals with varying mental illnesses come into classes. I had one come into my graduate psychopathology class last year, and they tell their whole story, and they kind of talk about the challenges they face and the treatment they've gone through and kind of what their life looks like currently and kind of what's going on. And I think that was really helpful for me to kind of see different illnesses and kind of what barriers have happened and what treatment is helpful. And I wonder, I don't know if they do it for high schools or middle schools, but I think something like that could be very helpful in kind of giving information about mental illness and putting a face to a name and kind of giving people an opportunity to meet individuals they might not have met in other instances. So a program like that could be very helpful if adapted for other venues like museums or classrooms or things like that.
don't know why I keep disconnecting, but yeah, no, I was able to hear all that. Good points. And I see that we have a couple more questions. I think we should move along a little bit, and then we could round back to these questions just to make sure we have enough time to cover everything. Let's see. Oh yeah. So I think next we should kind of try to talk about focus on the cultural factors that go into this. So some questions that I wanted to put out there are what are some cultural barriers to mental health treatment that people have witnessed, whether professionally or even anecdotally. I don't know if any of the panelists have something they want to add to that, and if anyone in the chat wants to add as well, feel free.
So to address August's questions on how effective are role models who share their stories and struggles, so I have read a few studies that have actually shown that the most effective in reducing the stigma and in promoting acceptance of the illness and the treatment has been peer interventions and peer groups. And that has actually been more effective than even having a counselor or a mental health professional working with the family. When families find other families that are dealing with the similar issues or even the same issues, that and having these people show this camaraderie actually has been extremely beneficial for families and in accepting and reducing these internalized stigmas. So yeah, it's the most effective is to have role models in other families that are similar to yours to help reduce the discomfort or the internalized stigma and negative perceptions.
Yeah, kind of piggybacking off of that, I think in knowing someone and having, direct contact with someone that has a mental illness, it allows us to kind of shed those stereotypes that we associate just due to an increased education. I think there's a lot of times stereotypes associated with, obviously, as we've been talking, mental illness. And so just knowing someone directly helps eliminate those stereotypes and promoting education. I think also at the family level, I wonder how much it would help a child to, especially if mental health or mental illness runs in a family, there's always that genetic component to it as well. So maybe having a conversation with your kid early on and saying, this is something that runs in our family, and I just want you to know that, be on the lookout for these kind of things. And if you feel that way, bring it to our attention and then we can address it. And so knowing people that have also struggled but are seeking out treatment and, effectively combating those symptoms, I think is definitely very helpful.
Yeah, I see actually Gwen talked about how put herself as a museum professional, and also Julie added that that museums should present paintings done by artists who suffer mental illness, i.e. Van Gogh. And I think if you do want to create kind of like community centers, like museums, and have them advocate for reducing mental health stigma, it might be good. Like obviously there are a lot of museums that talk about Vincent Van Gogh or have paintings, but definitely not explain exactly kind of the mental health issues that maybe the artist would suffer in the background, and make sure that that's kind of also a key component of when talking or discussing about pieces of art or whatever piece may be in the museum. So yeah, I think it'd be an interesting way to kind of normalize mental health, just have it be salient around wherever you go, even in a museum. So interesting point. Okay, so yeah, I think let's see if I missed any comments, but yeah, and when we're talking about cultural factors and kind of how parents perceive their mental health treatment, we have to talk about how if diagnostics really properly factor in culturally influenced presentations of mental illness. Like I mentioned earlier, especially among Chinese Americans, mental illness tends to be somaticized, so it tends to be explained or display in physical symptoms, headaches or stomach aches or just general muscle aches, and so it has to be mental health professionals especially have to be careful about how they approach when diagnosing somebody who may be from that cultural background. And that's especially a barrier if, especially with second generation immigrants, like you especially see in like Chinese American communities in LA, where you have a first generation of immigrants and then the second generation tends to be more Americanized or Westernized, and may have less of that. So it becomes a difficult bridge between the parent and the child when the parent sees mental illness and doesn't exactly think of it as mental illness as we may do, where they associate those kind of physical symptoms, whereas somebody who's already started drifting culturally further away from those maybe more homogenized communities perceive their own mental health symptoms differently. So something we can to keep in mind as well. And I'm not sure if anyone, I personally don't, but have any ideas on maybe how that can be addressed when generational cultural shifts kind of skew how mental illness even looks like and how to identify it.
To kind of answer what Sam is asking is, so coming from a immigrant household and being a second generation American myself, I feel like the most, in terms of my own experiences, it would probably be beneficial if the same kind of support groups that we were talking about earlier were made for these individuals, but it had other participants and it was made by organizations that is of the same culture. And I feel like with that may help bridge them together, may help facilitate education, and it'll also make the families feel safe because they're going to be among individuals who have the same culture and the background and ethnicity as themselves, that it may be helpful for them to then reduce this stigma and their internalized stigma because they have other families who are like them, culturally similar, ethnically similar, and then they were also dealing with this similar illness. So I feel like having that camaraderie again with people of the same culture and ethnicity and background may help reduce their stigma because they'll feel like they're not alone in that situation.
Yeah, good point. And I think maybe we can just move on to the last topic that we wanted to cover. Maddie, if you want to take away and round us out.
Gotta unmute myself. Yeah, sure, of course. So I was just gonna kind of cover the topics of labels specifically when it comes to diagnoses and some of the negatives and positives of having a label associated with your diagnosis. And so I guess I'll start with some of the negatives. But one thing I found across the board is that sometimes labels and diagnoses can be categorical in terms of severity or pervasiveness or just overall presentation. So just an example of this is, you can have 10 kids in a room or in a classroom that have ADHD, but it's very likely that no one kid is going to present exactly the same as another kid, right? There's a lot of symptoms that come with ADHD, those being inattentiveness or hyperactivity, or even executive functioning difficulties, but it's very likely that you can have a range. And so I think sometimes, parents are afraid of having a kid being placed in a box or a category due to the stigma that's associated with an illness label. I think we kind of touched on several other points just over the course of conversation, but one I think that sometimes parents think of is just that labels can lead to self-fulfilling prophecies, or in other words, people may use their illness as a crutch, for example. You could say, I have ADHD, and so I didn't get it much done today, and that's because of my illness, when it's good to have that mindset so that we're not so hard on ourselves, but I think sometimes that can get in the way of us living up to our what we really can accomplish. And another one that's kind of obvious sometimes that parents are worried about, I think, is that people can see the diagnosis first before the person. Again, going back to the ADHD example, I think, you can have a teacher in a classroom focusing only on, when they're aware that this child has a diagnosis, focusing only on the impulsivity or inattentiveness of a child, rather than really recognizing and highlighting the good, right? Because we all have positive characteristics and negative, or things that weaknesses, I guess, are a better word, and then strengths. And so failing to highlight the times a child maybe offered up insightful information in discussion, or was calm or kind to another student. And so I guess I want to open up to the group. We kind of touched on this a little bit, but ways that we can kind of reduce the stigma associated with these labels specifically. If anyone wants to go ahead. We have a comment from Ted, who said, when I worked as a behavior therapist within the autism community, we had a saying, if you've seen one kiddo with autism, you've seen one kiddo with autism, meaning no two individuals are the same. Yeah, definitely. Okay, so it looks like we have 5 minutes remaining, so I'm just gonna kind of shift over into some of the positives associated with having a label to a diagnosis. And I personally think this is controversial, but I think there's a lot more good that can come from attributing a label and a diagnosis when it's needed. So first and foremost, labels facilitate treatment, right? When you have a label and a concrete diagnosis, you're given with that a roadmap that you can kind of follow, and I think it eliminates a lot of the confusion that patients have when they don't have that. And yes, again, Julie made a comment, people first language is important, definitely. And so I guess my next point is labels can be really empowering, right? When we have a diagnosis and a label, we're able to look more into and understand our experiences and weaknesses more fully. This also opens the door to discuss the importance of highlighting the strengths that we have, right? Because everyone has strengths and weaknesses, and so being able to work through those weaknesses and recognize them while highlighting your strengths is, I think, definitely a positive. It allows us to connect with individuals who share similar experiences. And I think, we've seen that. We study chronic fatigue syndrome. And there's several blogs out there that have drawn they're very trafficked, right? And they have drawn this community together, and, being able to find others that share in their struggles and communicate and share resources. I think that there's a lot of power in that as well. And then my final point is preventing us from attributing self-blame or personal shortcomings to others or also to ourselves. And I want to give an example real quick if we have time, but without divulging sensitive information. I actually worked with a doctor one time who helped to counsel patients who were undergoing major surgeries, and there was one patient. He was a younger kid. Who had a cleft palate, and he was going to be undergoing surgery for that. And when asked, how he was doing, if he knows anyone else that has a cleft palate, he didn't actually even know that that's what it was called, or that the root of it, how that's caused. His parents never really gave him any of that information in regard to labels or cause. And so he actually had thought that it was because, I guess his words were, his parents consumed alcohol while they were pregnant with him, and that's why it happened. So I wonder, and I want to open this up to the group really quick if we have time, just what are some negative repercussions of not really divulging that diagnosis to him in terms of his relationships and his self-confidence? So one thing.
Yeah, I mean,
go ahead. No, go ahead.
No, I was just going to agree with you that, yeah, having a label is very helpful, and especially just understanding the ideology, why your experience is the way that it is. I mean, we see that especially in mental health, not being able to call something depression or be able to kind of parse out what different mental health experiences are under different diagnoses. I mean, then otherwise, historically, we've been seeing, mental illness just kind of get lumped in to one sum of just unwell or mentally unhealthy. And, it's you don't really, you lose your individuality and your sense of autonomy when that happens. So, yeah, no, it's a great, good topic to make sure that we're aware of. So we only have a minute left. I do see that we have more comments, but I do want to make sure we give enough time for the next presenters. I think some really useful takeaways, and other panelists can chime in. It's just make sure we do what we can at an individual level as professionals within the mental health community, in making sure that parents are well educated, but also maybe we could do more within our community centers and within our community, and try to spread mental health awareness and normalcy through our community centers and through educational programs or advocacy, or keep us suggested, through museums or other parts of our community. But, yeah. Thanks everyone for joining us today and hearing us out. Thanks to all the panelists for doing a great job.
Yeah, and also thank you for everyone who has asked questions and have left really insightful comments. Everyone had some really good and insightful things to say.